Every woman, man and child is entitled to enjoy a life of good health and equal opportunity. And Government of Gujarat is committed to promote the same through its incessant and innovative efforts in this direction. Government is dedicated to provide inclusive healthcare to rural and urban population throughout the state, with special focus on reaching the unreached and serving the underserved through a continuum of care approach.
In Gujarat, we have made programs where people's participation is the key, especially in social sector like education, health, agriculture. We undertake annual drives. In all these drives, one hand, we engage the entire political leadership and administrative machinery, and on the other, we involve people from all walks of life.
Under the dynamic leadership of Chief Minister Shri Narendra Modi, a true visionary, Gujarat has made a phenomenal growth with emphasis on development of this crucial social sector. A bouquet of various services for improving people's health has been initiated in last decade, aiming at strengthening the healthcare delivery system for benefit of one and all in Gujarat. 4 lakh Mamta Divas per year to provide antenatal checkup, immunization and nutrition services are held across the state of Gujarat. All pregnant women and children across the state are tracked for service provision through unique IT-based application eMamta. Kasturba Poshan Sahay Yojana is conditional cash transfer scheme for ensuring adequate nutritional support to BPL pregnant mother. Completely free antenatal care, institutional delivery, postnatal care and child care up to 1 year are provided completely free in all government institutions. All women delivering at government institutions are provided free transport back to her home through Khilkhilat vehicles. Flagship schemes Chiranjeevi and Bal Sakha Yojana have become exemplary models of public-private partnership for maternal and child health care to the BPL and tribal families of Gujarat. Chiranjeevi Yojana is bestowed with Prime Minister's Administrative Excellence Award. The infant mortality rate of Gujarat has come down to 38 in the year 2012 from 57 per 1,000 live births in the year 2003, registering a decline of 30%. Further, the decline in IMR in the last 3 years is substantial as the rate of decline has increased to an average of 7.5% per year, one among the highest in the country. Gujarat has come a long way to achieve Millennium Development Goal 5. Maternal mortality ratio, MMR, has reduced from 202 in 1999 to 2001 to 148 in the year 2007-2009. According to the latest SRS bulletin, Gujarat is 6th best performing state with regards to MMR and is most likely to achieve MDG 5 by year 2015. Declining sex ratio was a major concern for Gujarat, along with many other states of India. Sex ratio at birth, SRB, which was only 837 females per 1,000 males in year 2001, increased by 72 points to 909 females per 1,000 males in 2011 due to effective and strong implementation of Beti Badhao Andolan, led by Honorable Chief Minister Shri Narendra Modi. Child sex ratio declined by 45 points from 928 in 1991 to 883 in 2001. In the last decade, Gujarat has not only halted this decline, but actually reversed the trend and increased it to 890 in 2011. A judicial colloquium was held under the chairmanship of Chief Justice of Gujarat High Court to orient lawyers and judiciary on the special nature of this issue. Strong and effective actions are taken for defaulters of PC and PNDT Act so as to prevent doctors to do sex determination. Gujarat government recognizes the value of the children, who are the future of the nation. For this future to be bright and healthy, the school health program has been initiated whereby an annual 5-day festival is organized. This program is an excellent example of community participation and interdepartmental convergence and comprises novel features such as sanitation drive, nutrition education, and Dada-Dadi meetings. Nearly 1.5 crore children, school-going and out of school, are examined every year. Even the specialist and super specialist care such as for kidney, cancer and cardiology problems are provided free of cost. Complex treatments such as kidney transplant, liver transplant are provided completely free, and it has been a boon to the parents. 108 ambulance services penetrated every nook and corner of Gujarat. Nearly 40 lakh emergencies have been attended by 108, of which 1/3 are of the safe transfer of expectant mother for institutional delivery. A fleet of 525 ambulances saves one life every 14 minutes by ensuring dispatch of ambulance to needy person every 46th second. There is a robust 3-tiered health infrastructure consisting of 7,274 sub-centers, 1,168 primary health centers, 318 community health centers, 30 sub-district hospitals, 24 district hospitals and hospitals attached with medical colleges which provides quality medical care round the clock. 3 government super speciality hospitals are doing yeoman's job in treatment of cancer, kidney and cardiology. More than 3.3 crore patients are being treated as outdoor patients, nearly 40 lakh as indoor patients, and nearly 2 crore laboratory investigations are carried out every year in government institutions. Gujarat is the only state which has achieved NABH and NABL accreditations for a large number of public health institutions. Use of technology has been imbibed in the form of various information communication technology related projects such as Gujarat Hospital Management Information System, Drugs Logistics Information Management System, and Ability Gujarat. To enhance availability of medical professionals, Gujarat has immensely increased reach of medical education. Number of medical colleges has increased from 11 to 19 in last 5 years, leading to increased intake of medical students from 1,455 to 2,930 every year. A phenomenal growth has been achieved in the setting up of nursing institutes from 35 to 174 and increased intake from 1,257 seats to 7,005 through the state's dedication and endeavour. Mukhyamantri Amrutam Ma Yojana is launched to ensure inclusive healthcare by improving access of BPL families for the tertiary treatment of catastrophic illnesses. It provides cover of 2 lakh rupees per family per year. In a short span of 1 year, 63 hospitals, including corporate hospitals across the state, have been impanelled under this scheme, and nearly 15,000 people have benefited by this scheme, and thus preventing them from entering into vicious cycle of debt and poverty. Private specialists are roped in to bridge the gap of specialist services in government institutions under Chief Minister Services of Experts at Treatment Unit, popularly known as CM Setu. Gujarat has a substantially high tribal population, 15%, which is double the national average. Genetic disorders like sickle cell anemia are predominantly seen in tribal population. Public-private partnership with laboratories has improved screening of sickle cell anemia from 18 lakh screenings in last 6 years to more than 20 lakh screenings last year only. Screening activity is carried out with overwhelming support from Panchayat and Tribal Development Department. Screening of whole tribal population will be done in mission mode by 2015 to ensure sickle cell disease-free Gujarat by 2020. This scheme is also a recipient of Prime Minister's Award. The government of Gujarat has been providing free generic drugs in its healthcare institutions from 1978. Yet, in order to ensure the timely availability of quality medicines and equipments at reasonable costs, it has set up an autonomous institution, Gujarat Medical Services Corporation Limited. Further, this corporation will also strengthen the system of equipment maintenance so as to minimize the downtime of equipments. The diagnostic services will also be taken up by this organization in targeted areas at affordable costs. All these developments have been possible as health has come under government's focus, and as a result the budget allocation has been tremendously increased over last couple of years from 1,619 crore in 2007-2008 to 6,467 crore in 2012-2013, which is a substantial increase of 300%. Acknowledging higher proportion of ST population in Gujarat compared to India, around 17% of total health budget is earmarked under Tribal Sub-Plan, TSP. However, the road ahead of Gujarat is full of challenges such as non-availability of specialists, ensuring quality services, medical and paramedical manpower in remote and tribal areas, and challenges of geographic location to deliver strategic services at doorsteps. The emphasis has been laid to identify high priority talukas in the state, channelize health resources in these talukas through policy of special interventions, and have greater impact on morbidity and mortality indicators. Gujarat is committed to meet its future challenges and continue to show the same passion and dedication towards public health services, just as it takes pride in accomplishments and the smile that have been brought to the faces of the people. It also recognizes the challenges ahead. The state realizes that it needs to further strengthen its infrastructure with a more focused approach. Gujarat State constantly strives to evolve its health delivery systems and modernize itself through appropriate structures and mechanisms. There is a constant synergy between the infrastructure, the people, and the government of Gujarat, which makes the health delivery system more accessible, equitable, transparent, and cost-effective. Gujarat, through committed and concerted efforts, has come a long way in improving health of people through better healthcare provision. It is further duty-bound to continue sincere efforts to improve Human Development Index and ensure quality life to every citizen of its state.